My name is Sheldon and I'm a clinical neuropsychologist. I like to say I'm from all over the world. My dad was in the military. I lived all over the world before coming to Greenville in 1988, that was after getting a PhD in neuropsychology from the University of Arizona. Neuropsychology gives a person an opportunity to not only understand the person's brain, but help them in their recovery from stroke and traumatic brain injury. So it's not just a diagnostic service, but it's a way for a psychologist to be involved in the treatment of persons with a neurological disease. Interest in work and coming to work every day is driven by the fact that the human brain is still very much an unknown entity. So every day is an opportunity to learn more about the brain and use that knowledge to help others. I think the unique aspect for my practice is that I am part of an interdisciplinary team. So the neuropsychological testing that we do is not just geared toward assessment, but toward developing treatment plans that the patient's treatment team, physical therapy, occupational therapy, will use in helping them recover from their neurological injury. I think my style of practice is that it's embedded in the interdisciplinary team. It's not a solo practice, and it's emphasizing primarily traumatic brain injury and stroke as our area of specialty. I've chosen to practice at Prisma Health because it was an opportunity to develop that truly interdisciplinary team and to service a broad range of individuals. And the brain injury program covers the entire upstate and gives us that opportunity. Well, outside of healthcare, I'm really a big fan of the Swamp Rabbit Trail. So my wife and I love riding bikes. We wear our helmets and just enjoy being able to see our great community. I think the advice I'd give to my patients, particularly if they've had a concussion or a stroke, is that they be open to input from their family. Sometimes the brain can have injury and not be aware of the damage to itself, so be open to input. If you'd like to make an appointment with me, contact your primary care physician for a referral to the outpatient brain injury and young stroke programs.